Radiation dose reduction involves the strategies, techniques, and technology that is used to minimize ionizing radiation exposure to patients and healthcare workers, while maintaining the essential diagnostic and therapeutic outcomes. It is important to note that medical imaging plays a vital role in patient diagnosis and treatment. There have been various advancements in technology and the use of medical imaging, which also comes with the inherent risk of an increased use of ionizing radiation. The ultimate goal of radiation dose reduction is to provide the best patient care while minimizing the exposure to ionizing radiation. This is in line with the ALARA principle, which is the foundation of radiation safety. It stands for as low as reasonably achievable and promotes the idea that radiation dose should be kept as low as possible while still obtaining the desired outcomes. Modern imaging equipment can help reduce patient exposure with the use of iterative reconstruction algorithms and dose monitoring software. There are also protective measures like lead aprons, thyroid shields, and maintaining distance to reduce unnecessary exposure. Radiation dose reduction is important because even low doses of ionizing radiation can have long-term risk. Chronic exposure to radiation, even at low levels, have been linked to increased risk of cancer. Radiation can also cause skin burns or cataracts at higher levels of exposure. These risks are concerning for patients who undergo repeating imaging exams, as there is a higher cumulative radiation exposure and increase of adverse effects over time. Certain populations are more vulnerable to the effects of ionizing radiation, which include children, pregnant women, elderly patients, and patients with pre-existing conditions. By recognizing these vulnerabilities, healthcare providers can implement tailored precautions to minimize radiation exposure and associated risk. This ensures that medical imaging remains both safe and effective for all patients. There are safeguards that ensure consistency in radiation safety, which include quality assurance programs, diagnostic reference levels, and regulation guidelines. Quality assurance consists of regular equipment checks and protocol reviews to ensure optimal performance. Diagnostic reference levels provide benchmark doses for common procedures and help standardize practices. There are also regulation guidelines set by organizations like the International Atomic Energy Agency, or the IAEA, and the International Commission of Radiologic Protection, or the ICRP. These organizations provide guidelines that support safe and effective imaging practices. Radiation dose reduction is an important component of modern medical imaging. By using advanced technologies, following the ALARA principle, adjusting protocols to individual patients, and using protective measures, we can continue to ensure that medical imaging remains a safe and effective resource for diagnosis and treatment. The future of radiology depends on continuous innovation, dedication to patient safety, and the ongoing commitment to balance diagnostic and therapeutic precision with minimal radiation exposure.